All right. Well, welcome. I'm Dr. Gerald Maguire. Joining me today for our AdhereTech podcast is Dr. Greg Mattingly, also a GMMD. And we're going to talk about ADHD today. Greg, what do you know about ADHD? Why are you here with us?
You know, Jerry, the field of ADHD has really blown up in the last decade. Currently, I serve as the president of the American Professional Society for ADHD and Related Disorders. My office here in St. Louis, Missouri is a very busy site taking care of children, adolescents, and adults with ADHD, and also participating in multiple research trials looking at, how do we help to advance the field of ADHD for the families we take care of?
That's great, Greg. You are the guy for us to speak to, and I'm so thankful that you're here with us today. Today, we're going to talk a little bit about what are some of the unique behavioral and cognitive challenges that are unique to the ADHD population for adherence to medications, right? And we're also going to talk a little bit about the barriers to actually getting patients with medications for ADHD and how technology to assist that adherence could actually help. Greg, what are some of the behavioral and cognitive challenges that patients with ADHD have in taking their medications regularly?
We know that core symptoms of ADHD involve impulsivity, forgetfulness, disorganization. And just think about it, Jerry. Impulsivity, disorganization, forgetfulness, all just inherent challenges in being with anything consistently, especially a daily routine of taking your medicine. We also know that people with ADHD put themselves in harm's way, and it may be a roommate who also has issues. It may be a family member who has issues. And so there's issues around safety and compliance there when we talk about how do we not only get the medicine to our patients, but how do we keep it safe in the meantimes as well?
And guys, I have new third-year residents starting in clinic. And so oftentimes we get the request for a refill or a patient with ADHD if they're late for their appointment. And my reps say, why are they late? Why did they let us know the refill ran out yesterday? I'm like, this is ADHD. Am I correct on that?
You've got it. You got it. If they could plan and organize, they probably wouldn't be coming to see us, right, Jer?
That's right. They're like, hey, Dr. McGuire, why you let this guy come in? They're like, that's his condition. He forgot to come. Yeah, it wasn't like super bright guy. Like, this guy's an engineer. How does he not remember this? And how do you respond to that? I have my way of saying that, but how would that be?
Jerry, I sometimes tease. You may not know who in your clinic has ADHD, but your secretaries do. Okay. Your secretaries do because they're the ones that show up late. They forget to bring their copay. They call in urgently asking for medicines. Yeah. They've had a gap in 2 months where they haven't had their medicine and now they need it all of a sudden. And so I think consistency is the key. Consistency is the key. And that's where I'm really excited about the technology that you guys are developing about how to help people be consistent, how to give them reminders, how to give us reminders so we can make sure that people are doing what they're supposed to be doing with their medicine.
And we know that clinical studies, indicate that maybe up to 80% of adults with ADHD fail to adhere to their treatment plan within the first year. Is that correct?
At least. So study after study, whether it's kids, adults, adolescents, have shown that, consistency is a difficult challenge for people with ADHD. We used to think we were doing a good job if people took 4 months out of 12 in a year. We've gotten that number up to maybe, 50-50, a 50-50 shot with our standard technologies. So, Jerry, as you just said, we know that 80% or more of our patients on ADHD medicines will not get through the first year consistently with taking their medicines. Part of that's their disorganization. Part of that's forgetfulness. Part of that's impulsivity. Part of that's, just the situations they find themselves living in. Imagine a college student going back and forth to classes, trying to remember to reach out to his doctor to get a refill at the appropriate time. Imagine, I take care of a surgeon. He's right now in sabbatical in a different part of the country, trying to remember to reach out and get his medicines filled. And then remember, ADHD usually runs in families. So it's easy to say, your parents should remind you if you're a kid with ADHD, but that parent may have ADHD as well. So we know that it runs in families. We know that forgetfulness is a key component. Disorganization can be a key component. And, being impulsive, where I don't plan things through the way I should.